Today is Wellness Wednesday, and today we are talking to Dr. Jeanie Cote, a neurologist at Memorial Healthcare's Institute for Neuroscience who specializes in the treatment of multiple sclerosis. Good morning, thanks for coming on.
Thank you for having me.
Yes, of course. First off, tell us a little bit about what multiple sclerosis is. First off, it impacts millions of people.
Right, so multiple sclerosis is an autoimmune disease where your immune system, which is supposed to be protective, accidentally misidentifies the target and causes attacks or damage. With MS, those areas of damage include the optic nerve, brain, and spinal cord. So symptoms can be variable from loss of vision, numbness, weakness, and really while we mostly think of it as starting in someone who's in their 20s to 40s, it can be much younger and much older before it's diagnosed.
Wow, I mean, it really impacts a person's health. And we know that March is recognized as Multiple Sclerosis Awareness Month. Why is it so important to keep a focus on MS?
So one of the important themes over the last number of years has been earlier diagnosis and earlier access to treatment. We know that that really can help control for outcomes, decrease disability, decrease symptoms. And so the more awareness, the more early detection, the better the journey for our patients.
Tell us a little bit about yourself. How long have you been doing what you do?
So I have been a practicing physician about 10 years now. Before I became interested in MS, I had to be a neurologist first, but it was actually a young girl who had a spinal cord injury from MS that really, when I crossed paths with her as a medical student, I said, this is where I want my world to be. This is who, it just called to me.
Yeah.
And then from there, entering into neurology, you know, watching the field of MS just explode with innovation. Every decade we've had more treatments, we've had better imaging techniques, better symptomatic management. And my own mom has MS, so watching her journey compared to what someone nowadays could access really also just cemented, I think, my love of the field and my interest and passion in working with MS patients.
Yeah, so it's personal for you. It's a personal mission.
100%.
Well, you touched on this. So what types of treatments are available nowadays for patients with MS?
So when I talk to patients, I talk about a two-pronged approach. One is the treatment or the disease-modifying therapy to address the MS itself. And those are medicines that modulate the immune system to cut down on scars on MRIs, relapses, and hopefully decrease symptoms changing over time. In that way, we have really at this point a plethora or so many treatments. We have pills, we have injections, we have infusions. In the old days, treatments might be a shot every day, which wasn't always the easiest to tolerate, but patients did it. Nowadays, we've come as far as infusion treatments that take 1 hour twice a year to do a wonderful job managing your MS.
So that's where the Memorial Healthcare Institute for Neuroscience comes in. It is just one of 5 facilities in the state of Michigan to be recognized as a Center for Comprehensive MS Care by the National MS Society. Why is that recognition so important?
So, you know, I obviously am biased because I am an MS specialist, but I fully believe MS, as complex as it is, really should be managed by people who are passionate about MS care. And by being a comprehensive center, it really brings a lot of different MS specialists together in one place. So if someone comes to see me, they're not only getting care from me, I have MS rehab doctors on site, I have neuro ophthalmologists on site, I have nursing, social work, everybody who knows all of the resources and support and really complements what I don't know when it comes to managing MS. You know, I know what I know, but I also don't pretend to know everything. And in having this team network, we really, I think, cover the basis and give exemplary care.
Yeah, it sounds like you're really at the forefront there. I also hear you have a new certification for Neuro Obesity. Can you explain what that is?
Yeah, so circling back to kind of my two-pronged approach to patient care. First is the disease-modifying therapy, but the other part is managing symptoms. And one of the symptoms I think all physicians are seeing over time is an increase in overweight and obesity. And as a physician, I'm a lifelong learner, so I thought, well, let's go get board certified in this too. So I went back to school while maintaining my MS practice and picked up board certification in obesity medicine. And really my hope with that is to just help manage patients struggling with weight. The reason it matters in an MS world is if you have weakness or if you need help to transfer to a commode, into the kitchen, into the shower, less weight on the body can help you remain independent longer. You know, turning easier to protect skin. So many symptoms can be magnified by weight that if we can help control that too, anything that helps my patients, I want them to have access to.
Hey, you are clearly dedicated to what you do. And then just finally, back to some of those treatment options. Tell us about any upcoming clinical trials. I mean, it sounds like you're always trying to make advancements in the field.
Yes, super exciting, both what we're doing at Memorial and beyond. So there's a lot of innovation, or at least areas being looked at in the MS world. There are drug trials. One of the more interesting ones right now is looking at a new medication that may have better penetrance into the brain and microglia. That could be really important for patients with a progressive type of MS. There's a trial looking at stem cell transplants and how that compares to high efficacy or what we consider sort of top of the line treatments. There are studies looking at diet, supplements, reparative or remyelinating therapies. We even have a fun study right now looking at ways patients can track symptoms and then that information be sent to us for review, looking to see is there a better way to stay connected with our patients beyond visits, you know, every 6 months or so.
Very interesting. I mean, bottom line, sounds like you're in good hands at Memorial. We thank you so much for your expertise and your time, Dr. Cote. For more information about the Memorial Healthcare Institute for Neuroscience, you can visit memorialhealthcare.org or call the number 989-723-1390.